A screening test with high sensitivity is preferred because it. Correct answer is option B. Maximize true positive. Which epidemiological study provides the strongest evidence for causality among observational studies? Correct answer is option C. Cohort study. In a disease outbreak, the first action of the community health nurse is. Correct answer is option B. Confirm the diagnosis and existence of the outbreak. Which measure is most affected by the duration of disease? Correct answer is option C. Prevalence. The iceberg phenomenon in epidemiology refers to. Correct answer is option B. Visible and hidden disease burden. Which epidemiological measure is most useful for identifying the cause of a disease? Correct answer is option B. Incidence rate. The strongest evidence for causality among observational studies comes from. Correct answer is option C. Cohort studies. Which measure reflects the burden of disease in a population? Correct answer is option B. Prevalence. The denominator for maternal mortality ratio is. Correct answer is option C. Live birth. Which factor most strongly influences community participation? Correct answer is option B. Community ownership. Continuous monitoring of selected disease. Correct answer is option A. Continuous monitoring of selected disease. The best indicator of socio-economic development is. Correct answer is option B. Life expectancy. Which study begins with exposure and follows subject forward? Correct answer is option A. Cohort study. Which level of prevention aims to prevent risk factor emergence? Correct answer is option D. Primordial. Which measure is most useful during an epidemic? Correct answer is option B. Attack rate. The gold standard for evaluating intervention is. Correct answer is option C. Randomized controlled trial. The best method for measuring vaccine effectiveness is. Correct answer is option C. Cohort study. The most appropriate measure of central tendency for skewed data is. Correct answer is option B. Median. Which indicator is included in the Human Development Index? Correct answer is option C. Life expectancy. Directly observed treatment short course is designed for. Correct answer is option C. Tuberculosis. The major limitation of cross-sectional studies is. Correct answer is option B. Cannot establish temporal relationship. Which epidemiological study is least expensive? Correct answer is option C. Cross-sectional study. The most important source of demographic data is. Correct answer is option A. Census. which is a composite health indicator. Correct answer is option C, physical quality of life index. Which disease is targeted for reduction globally? Correct answer is option C, polio disease. The principal objective of surveillance is. Correct answer is option C, continuous collection and analysis of health data. The best indicator of health service utilization is. Correct answer is option A, bed occupancy rate. An epidemic occurring worldwide is called. Correct answer is option C, pandemic. Which factor does not influence health behavior? Correct answer is option D, blood group. The major aim of health education is. Correct answer is option C, change behavior positively. Which statistical test compares proportions between groups? Correct answer is option C, chi-square test. The concept of risk population refers to. Correct answer is option C, population susceptible to disease. Which level of prevention includes rehabilitation? Correct answer is option D, tertiary level. The best indicator for evaluating maternal health service is. Correct answer is option C, maternal mortality ratio. In biostatistics, standard deviation measures. Correct answer is option C, dispersion of data. Which statement best defines community health nursing? Correct answer is option C, application of nursing and public health principles to promote community health. A child with tetralogy of Ford suddenly develops a cyanotic spell. What is the priority nursing action? Correct answer is option C, place the child in knee-chest position. Which finding is most characteristic of heart spring disease? Correct answer is option D, failure to pass meconium within 48 hours of birth. The earliest sign of increased intracranial pressure in an infant is. Correct answer is option C, bulging fontanelle. Which symptom is most indicative of intussusception? Correct answer is option C, current jelly stool. The priority assessment for a child with acute glomerulonephritis is. Correct answer is option C, neurological status and blood pressure. Which congenital heart defect is associated with a machinery-like murmur? Correct answer is option C, PDA. A child with meningitis should be monitored closely for. Correct answer is option C, increased intracranial pressure. Which vaccine is contraindicated in severely immunocompromised children? Correct answer is option C, live MMR vaccine. Which electrolyte imbalance is commonly seen in severe diarrhea? Correct answer is option C, hypokalemia. Which assessment finding is expected in pyloric stenosis? Correct answer is option C, projectile non-bilious vomiting. Wheat finding suggests Kawasaki disease. Correct answer is option A, strawberry tongue and prolonged fever. The most serious complication of Kawasaki disease is. Correct answer is option C, coronary artery aneurysm. A child with diabetic ketoacidosis is most likely to exhibit. Correct answer is option C, chromosomal respirations and dehydration. A child with hemophilia should avoid. Correct answer is option C, oral hygiene.